Hello everybody! So my name is Casey, and this semester I decided to do my project on Alzheimer's in the United States. So I'm just going to start off with some background information about what Alzheimer's is and some symptoms that those with Alzheimer's may experience. So Alzheimer's is the most common cause of dementia, and dementia is just a general term for the loss of memory and the loss of other cognitive abilities. So it is a progressive brain disease that results in the loss of neurons and their connections. In the early stages of Alzheimer's, memory loss is mild, but then the disease progresses into more severe symptoms. Some symptoms of those with Alzheimer's are repeating questions or statements, forgetting important things such as conversations, events, or appointments, getting lost in familiar places, and when the symptoms become very severe, they may lose the ability to remember their family members, hold a conversation, or respond to their environment. Alright, and why have I chosen this public health issue in particular? So I chose to focus on Alzheimer's in the United States because there is a lot yet to be learned about the disease. Scientists do not fully understand what causes the disease. They have some ideas and theories of possible causes, but the exact cause is still unknown. So therefore, as people in public health, if we don't know what causes the disease, it is hard for us to effectively prevent it. And public health is primarily about the prevention of disease. So there is also currently not a cure for Alzheimer's. So because there is so much to be learned about this disease is why I chose it, because I think informatics could play a big role in helping us to learn more about what causes it. And I decided to focus on the national level, more specifically the United States, because according to the CDC, it is currently the 6th leading cause of death in the United States. So not only is it a disease that we don't know much about, it's also very prevalent, and it's one of the leading causes of death in the US currently. Alright, and then for this project, I decided to focus on big data. Big data is one of the 4 drivers of change in public health informatics. And big data is very important because it can be used to track patterns and trends. And there is a lot of health data out there, but unfortunately it is not all available for use, and it is not being utilized to its full potential. And I think a great example of this was the TED Talk from Discussion 13 this semester. In this TED Talk, the speaker, named John Wilbanks, discussed the vast amount of health data that isn't being utilized for research. And during this talk, he gave a lot of great examples, and one of those examples he gave was of cancer patients who signed up for a clinical study. And there was so much information coming from these studies, but it couldn't be used. So when he spoke to the survivors and they learned of this, they were outraged. Rather than being happy that their privacy was being protected, they were angry because all this information couldn't be utilized to help other people. And so the overall theme of this TED Talk was about how if health data isn't being utilized, then it's basically useless, and how using these large pools of data from people could result in learning so much more about various diseases. So I think that using big data and pulling together health data from millions of adults could help to detect trends and find similarities between those who develop Alzheimer's and those who don't. Alright, and then some limitations of using big data to detect trends and those who develop Alzheimer's. So of course, in order to be able to access this big data, we have to address a very big hurdle, which is the issue of privacy. So as he discussed in the TED Talk, there are all kinds of privacy restrictions for medical data and data silos, and we cannot get to all of this data. And there are also those who do not want their medical information to be accessible for whatever reason. So in order to access the big data and find the trends, we would have to get around issues of privacy and find ways around that. And then another limitation to consider is, even if, there are trends and similarities found, in those who develop Alzheimer's, this does not necessarily mean that it will be enough to determine an exact cause. So using big data to detect the trends might bring us closer. It might make us understand the disease more, but it still may not be enough to find what that direct cause is of Alzheimer's. All right, and then here are my sources.